Now this is 9 o'clock, so we're just gonna go ahead and start. So for those who don't know who I am, my name is Sarah Trinh. I am one of the VietMD instructor. And I'm gonna be your instructor for the next few class. I am a neonatology fellow, so I'm taking care of premature babies in the neonatal ICU. And today we'll talk about informed consent. Before we start, a couple house rules. Making sure you have your camera on, because I believe that is the crew of the class. If you have any questions, please feel free to put them in the chat box. I can either go back and try to answer them, or one of the instructor can also help out and try to answer us if they can. The other thing is I have a tendency to speak very quickly, very fast. So if any one of you have trouble with understanding, or if I'm talking too fast for you, you can let me know using the reaction. There should be on your Zoom function bar, there's a reaction button. And there's a slow down button with the 2 arrow pointing to the left. If you click that, that will kind of let me know that I need to go a little bit slower. All right, with all of that out the way, let's start. Okay. So any of you know what is informed consent? All right, please feel free to unmute yourself and talk. I want to be as interactive as we can. So let me know if any one of you know what is an informed consent. All right. So I believe all of you probably know what it is. I think we're just a little bit shy to kind of talk. But this is what informed consent is defined by the American Medical Association. So informed consent for them is the process where the physicians explain the recommended treatment plans to the patients, including the pro and cons, and allow the patients to make informed decisions about what will happen to their health. And this is what they should include, or what the physician should do while trying to perform that process. And that's what we will talk about today. So an anatomy of an informed consent, just kind of like the outline of what it should be. So usually that includes what you are recommending, what treatment, what procedure you are recommending to the patients. That need to be include the risk, the benefits of the treatment that you are proposing, the potential outcomes of that. So the most likely outcome, the least likely outcome, the rare issues, possible complications. Any kind of treatment in medicines have potential for complications, and that is very important to discuss with patients ahead of time. And this is usually the time for you to do so. Another very important part is alternative options. So not every treatment is needed to be performed. There's own way, other alternative options, a treatment plan that you can do. Albeit it might not be the best, but it's still an acceptable form of treatment for that specific conditions. And usually the last part is usually the legalized, formalized part, where you obtain signatures of the involved parties. Type of informed consent. So the most common one is written consent. So where all of the information is written down on a paper, the patient is given the documentation for them to review, to read through, to ask questions about before they sign at the end. Usually a legal documentations, you have to keep it for the in the patient record. Another one that is also quite common, especially in a little bit more urgent situations, is the verbal consent. So this is where you just explain the procedure, the risk, the benefit to the patients verbally, and then the patient has a chance to ask questions, and then they verbally saying that they agree to proceed or not. A phone consent can sometimes be done, especially for those who usually for loved ones. Like, for example, if you have a child admitted to the hospital and for some reason you are not in the hospital at the time the procedure needs to be done, the physician can sometimes call you on the phone and obtain that consent. Similar for other, like if your parents or your other loved one is in the hospital, that can happen. Usually it is in a little bit more of an emergency case. So most of the time we try to get the patient's parents, get next of kin, guardian to come to the hospital and try to get it in person. But if there's a time crunch, then we sometimes do phone consent. And the last part is emergency waiver. So in case of an absolute emergency, if the patient is having a life-threatening condition that if you don't intervene, the patient will die, then sometimes you can waive the consent and just perform the procedure and then come back to the patient and or the family to obtain the consent later, or just kind of explaining what you did later. Right. So it not just consent, it informed consent, because that is very important. And your job is to ensuring that part happen, right? So the first part, to be able to be informed, the patient needs to be in a certain mental state. So your job is to always assess what is your patient's mental capacity at the time that you obtaining the consent from them. Because if your patients have an older mental status, it means that they, for some reason, are not as themselves. Like if they have a stroke, if they're in a coma, you won't be able to obtain consent from that patient, and you should not obtain consent from those patients because the medical condition might be affecting their thought process and they might not make the most sound decisions in that state. Other patient with intellectual disability might also may not be in the best mental capacity to make an informed decision. Patient with severe psychiatric conditions, so suicidal patients may refuse to be admitted to a psych unit, and that might not be the best decision for them to make at the time in that mental state. So you might need to find an alternative person to obtain consent from. And then lastly, the patient who are minors. So a child that you will need to obtain consent from their legal guardian instead. All right. And since we're talking about getting consent in case of a minor patient, so there's a difference between consent and assent. And it's a very important thing to understand, especially for any who work in pediatric. So legally in the United States, if you want to perform any kind of procedure on a patient who is a minor, which is in the state is less than 21 years of age, you need to obtain the consent from their legal guardian, means their parents or whoever the law recognized as their guardian. However, in some rare cases, what the guardian wants to happen and what the child wants can be in conflict. And so you also, a lot of time is recommended to also obtain assent from the patient. So you're getting the consent from the legal guardian, but you also talk to the child and making sure that he or she understanding what is happening and that he or she is okay with the treatment. And that can sometimes create a little bit of a a dilemma in some rare cases when the parent is insisting on the treatment, but the child is refusing treatment. So legally, you still have to proceed, but it make it a very uncomfortable situations for a lot of physicians, and sometimes we'll get the ethic board involvement and try to help kind of sort out the situations. I think not every place in the United States have an ethic board that we can use, and I'm not sure if that's something that you guys have in Vietnam. But in bigger institution in the United States will have ethic board. So whenever there's a conflict between the treatment team or conflict between different parties involved in a patient care, we can get the ethical team involved and kind of help sort out that issue. The next part is to do it in an understandable language. And that's why kind of part of the reason why we're talking about that to you guys right now, right? So let's say you have a patient who comes to Vietnam for traveling, and they got into an accident and showed up in your hospital. Your job is to, if you need to do any kind of procedure to a patient, they probably are used to the way things happen in the United States. They probably will expect some kind of informed consent from you guys. And for you to actually do that, that need to be in English or in a language that they understand. For us, we also kind of have other restrictions. So we usually make it in a non-medical language. So as we all know, medical professionals love their terminology and jargons. And a lot of time, most people don't understand what we are talking about. So the goal of informed consent is for the patient to understand what is happening to them, what is proposing to them, and in order to make a decision. So you need to making sure that you use the language that they understand. So most institutions in the United States would require a written informed consent to be written in a language that is no higher than an 8th grade reading level. It means that any kid who's in 8th grade should be able to understand that. There should be minimal medical jargons. You can mention the names or the terminology of the procedure, but that need to be explained. You cannot just throw the name out and then stop at that. And then just making sure your patient's understanding. And there's a couple of different ways. There's the learn model where you kind of teach the patient and ask them to kind of like teach it back to you just to kind of assess how much they understand. And that is very important part of informed consent. And last part is proper documentation. So this is more of a legal requirement. You need to making sure that you have the patient's or the surrogate signature to signify that they are authorizing to proceed with the procedure. Your signature need to be on there. It usually the person who obtaining the consent, or most of the time the person who performing the procedure need to sign the paperwork. Usually in the United States, we require to have a witness when you're performing any kind of consent. So someone who's not performing the procedure need to be there and just to kind of say that they were there and witness you doing all of the process. And a lot of time, even in the United States, we have patients who do not speak English. And so sometimes we require a need of an interpreter for them to kind of like during this process. And so if they are present, they also need to sign the documentation. All right. So here are the few common procedures that require consent. So this is definitely nowhere near an exhaustive list of procedure that you need consent, and what require consent usually different in different institutions. So the best way is to refer to your institutions and ask them to, like, what kind of procedure do you need consent? So that would be the most important part. But the thing that we get consent the most for is any kind of blood products transfusion. So packed red blood cells, plasma transfusions, platelet transfusions, stuff like that. Chemotherapy, any kind of anesthesia, like even for like basic local anesthesia, like epidural or general anesthesia, you will need consent. Any kind of invasive procedure, so intubation, central line placement, lumbar puncture, colonoscopy, catheterizations, all of those will require consent. Some other minor procedure might not need consent, so IV placement usually doesn't need consent. Like basic suturing in the emergency room, most of the time doesn't need like a written consent. Any kind of major surgical intervention will require consent. And sorry, that is a type of medical research. So any kind of medical research will definitely require consent. And that is governed by the ethical board for research in most institutions in the United States. Right. So in order to do good consent, you need to be able to explain it, what you want to do to the patients. So you need to be able to explain the common procedure in a layman term, right? So here is kind of a little bit of what I kind of like the common terminologies and how I would explain those. So intubations is just putting a breathing tube. Centralized is inserting a thin catheter into large vessels. And then this is kind of the common suffix in English medical terminologies, right? All of those Latin roots that you're gonna need to know. So like any kind of graphy is taking pictures or measuring something. So radiography is taking picture using X-ray, etc., etc. Scopy is taking internal picture using a camera. So colonoscopy is like the common procedure that we talk about. Synthesis is to aspirate or obtaining fluid from a cavity, right? So thoracocentesis is where you put a needle into the chest and obtaining the pleural fluid. Pericardial synthesis is where you obtain the fluid around the heart. Paracentesis is when you go into the abdomen and try to obtain the fluid in the abdomen, etc. There's like any kind of cavity you can use that word for. Tomy is to cut into an organ. So tracheostomy, ostomy is a little bit different, but colotomy is getting into the stomach. Thoracotomy is cutting into the chest. Ectomy is to remove the entirety or part of the organ. So colectomy is removing the whole bowel. Or you can do partial colectomy, just remove partial part of the bowel. And then plasty is the common suffix for if the procedure is trying to fixing or adjusting an organ. Like rhinoplasty is fixing the like the nose structure, right? So nose job. Or arthroplasty is where you try to fix the joint, etc. So there's a lot of terminology, and we're not going to have time to try to explain all of them. This is usually you kind of having a collections of the common term that reflecting your specialty and kind of know them and kind of try to explain them. I do have a little useful resource here. If you go to that link is where there's a lot of like common terminology that is explained there. So if you guys kind of got stuck at some terms, that would be a good resource to go to. All right, so let's do a little bit of brainstorming. since most of you are here are medical doctors or medical students, I challenge you to think of a procedure that you commonly perform that you struggle to describe, and then hopefully the group, the other can help you figure out how to describe that. All right, don't be shy. I want you guys to talk. We're here to practice. We're here to discuss. So talk away. All right, if you are not volunteering, I'm gonna help you guys volunteer yourself. Oh, I saw Đỗ Thị Nga raise your hand. Feel free to unmute and talk.
Okay, sir. Hi, guys.
Hi.
Hi. Because I'm an anesthesia, so anesthesiologist. So usually I have to perform an intubation procedure. And can you hear me? Yeah,
yep, I can hear you.
Yeah, is a intubation. Yeah, it's
Okay.
mean intubate and breathing tube into the trachea of the patient.
Yep. Yeah, I think that is a good way to explain it. The one part that the patient might struggle with is the word trachea. So trachea is actually a medical terminology, and not a lot of people knows about them, layman wise. So what can you use instead of trachea? Do you know, kind of as a layman term to substitute for trachea?
So I think I will use the airway. That means you use the breathing tube in your airway to control your breath.
Yeah, that is perfect. So yeah, that's how I usually explain it to my patient too. So just putting a plastic tube into your airway or into your windpipe is the other word that Americans tends to use to describe intubation. So that's excellent. Thank you.
Thank you.
All right. Anyone else who have any procedure that they struggle with? Because you guys gonna need to need these description for your practice later. So this is your chance to kind of ask those before we go into the real practice.
There are a few items in the chat. Hemodialysis.
Perfect. So who can help your friends out? How do we explain hemodialysis? Yeah, this is a tricky one. Han Hang, you want to give it a shot, or you want me to help you out?
I really find difficult to describe, to explain to the patient how hemodialysis and how to make them agree with our treatment. So I really wanna, if the MD or doctor can help me to describe the system.
Okay. Yep. Anyone who had any ideas of how to describe it? All right. So for those who not knowing what that word is, hemodialysis is the process where we trying to remove the byproducts in the blood of the patients using the machines, trying to replace the kidney of the patients, right? So in Vietnamese it's lọc máu. So that is kind of how I describe to patients. So usually I told them that like all of our body, through the regular process of living, we create byproducts, and that is floating in the blood that need to be removed from the body. And usually your kidneys will do those jobs nicely without any issues. But when your kidney is not working appropriately, those can build up in your body and cause trouble. And so hemodialysis is where I connect you to a machine that is a man-made kidney, where your blood can go through the machine for those like toxic byproduct to get removed, and then we return the blood back to you. So that is kind of how I explain hemodialysis. I don't know if anyone like Anwina and then have any like additions to that kind of process, or Helen probably have also have her way of explaining that too.
Yes, I also say filter. Like basically, I translate lọc máu. So filter all the bad chemicals from your blood because your kidneys aren't working.
Yep. Yeah, perfect. Thanh Hằng, does that work for you?
I got it. Thank you very much.
Perfect. All right.
There
and then
was a question in the chat about what will you do if someone from Vietnam comes to the US? How do you get for an interpreter or a translator? Do patients have to pay for that? No, the hospital pays for that interpreting service. So the patient doesn't have to pay. Either the hospital pays or the patient's insurance plan is obligated to provide an interpreter. So oftentimes I will see patients and the health plan, the insurance, giống như cái hãng bảo hiểm đó, người ta phải gửi người để vô thông dịch.
Yeah, so we also have kind of similar things. So we have the in-person interpreter that contracted by the hospital, or for some rare language, we have the phone interpreter that can help with some of these process. And I also a qualified working provider. So because I am a Vietnamese native, so I am allowed to translate. There's a process that you have to go through to be able to do that. So you are not automatically qualified to be like interpreter or to talk to patient directly in your own language unless you go through that process. So that's sometimes you have that as well, and that's why knowing multiple language can be helpful in medicine. All right, and then I have pleural aspirations and drainage. Anyone want to give it a shot? All right, Thu Huệ, how would you usually explain to your patients? Right, are you still there?
Yeah, I'm here.
Hello, Sarah. Just stop sharing so we can see everybody.
Yep.
Thank you.
I actually still have a few more slides, but yeah, I can stop and then I reshare it. Give me 1 second. There you go. All right. So where are we? Huệ, go ahead.
Oh yeah, I have difficulty when describing this procedure. And can you hear me?
Yep, we can hear you.
Okay. Yeah, I have difficulty when talking about the research this procedure to the patient.
Yes, so I assume that your patient probably have some kind of pleural effusions that you need to collect the fluid from. That's why you need to do that procedure.
Yeah.
Yeah. So usually I would explain to them that during this procedure, I need to insert like either a small needles or a chest tube, whatever you need to drain the fluid into the area around the lungs, usually between your ribs, and allow the fluid that accumulating around your lungs to drain out of the body, either for diagnostic purposes or for treatment purposes. Then you can kind of like talk through that. So that at least how I explain chest, thoracocentesis and chest tube placement for my patient. All right. So we are almost out of time. Let me finish the last couple, and then we can. So this is what I kind of have in mind for you guys. So there's a couple practice scenarios that you guys can use when we get into the breakout room. So this is a common one that I feel like most of you guys will see quite a bit. And this is the advanced scenario that you guys can kind of practice and talk to with your TA, or you can just make your own scenario. So whatever the common procedure you do in your workplace, pick a scenario, tell it to your TA, and then they'll be able to help you out with that. But if you don't have any idea where to start, these are the few scenarios, and your TA has those. And this is what I want you guys to walk through with your TA. So read the scenario, identify for me which person you will obtain the consent from. Is it the patients or is it someone else? Explain the procedure to the patients or whoever you are obtaining the consent from, and then discuss the risk, the benefits, complications, and the alternative options. All right, so that's what kind of gonna be the main task for you to practice on today. And so